Hi, Nancy Harvey with Opargo, talking today about a hot topic in many private medical practices. I've been working in and around medical practices for the last 27 years. Yes, I started young. Anywho, in those dealings with these practices, I heard often that there's a struggle to equally distribute patients that have been referred to the practice, but not a named provider. Opargo took on that challenge and said, you know what? Let's add additional functionality to our optimization tool to help out. In order to implement the equal distribution tool in a practice, we need to understand their business goals. Do we want to equally distribute the patients that are available to the providers in the same discipline? Or do we want to provide a preferencing model? An example there might be maybe you have a new provider coming on board that does not have an established practice. The existing providers want to really incent that doctor to be excited about joining their group, and so they're going to allow this provider to receive 5 patients to their one. Regardless of the model, if it's equally distributing or a preferencing model, we still want to remove the ability for staff to play favorites. That's definitely happening in practices, as well as better educate them on which providers can see different types of patients based upon the patient's condition and that doctor's discipline. You think that's simple, but there's a lot of ambiguity in practices, with schedulers not really knowing who can see which types of patients. As a next step, we'll set up distribution groups based upon the provider's discipline in your practice. Providers can opt in or opt out of groups as they see fit, but we want to make sure that we're equally distributing knee patients to other knee providers. You wouldn't equally distribute foot patients and knee patients together. That wouldn't be equal at all. And then sometimes we create separate distribution groups based upon locations. It really depends on how often different providers are traveling from one location to the next. Let's take a look at equal distribution from a scheduler's point of view. We will show you how we make the magic happen. This patient is complaining of an acute back injury. They injured their back while moving and has films. Let's select Find First Available to get them an appointment. Based upon their discipline, we have 2 providers that are configured to see acute back injuries in our practice. We can see that Dr. Koo and Dr. Dodge have availability tomorrow morning. Patient, I have an 8 a.m. slot. Will that work for you? Awesome. Let's get you scheduled. Like we always see in Opargo, it pushed that information off to the practice management system, and we have a confirmation of this patient's appointment. The next patient that calls has a very similar injury. He also has an acute back injury and needs to be seen as soon as possible. Selecting Find First Available again will bring up appointments for this patient. Now remember, the last visit that we scheduled was with Dr. Koo. If we take this into playground lingo, Dr. Koo got his turn, and now it's Dr. Dodge's turn, so Dr. Koo's appointments are no longer showing. This encourages the equal distribution of the patients in your practice. Let's go ahead and schedule this patient with Dr. Dodge. A third patient has presented with an acute back injury. We're really having a run on these today. This patient injured themselves while skiing. Search for an appointment. Now that Dr. Dodge and Dr. Koo both had their turn, both of the providers are showing again. Pretty cool, huh? Can you see how the equal distribution works? The visits that we just scheduled will be equally distributed amongst the providers that can see them, all the while not compromising patient care in the name of equality. It's just another example of taking difficult scheduling struggles and opportunities for optimization within the practice and solving them with Opargo's crazy cool technology. If equal distribution of patients is a hot topic in your practice and discussed at every other or maybe every board meeting, call me. Let's talk about making your life easier.